They say when you want the best for your children, you look for the best opportunities the world can offer. And for many American doctors, that dream is for their children to follow in their footsteps and become doctors too. But here's the twist. Many of them are not sending their kids to medical schools in the United States. Instead, they are sending them across the ocean to the Philippines. And you might be asking yourself why. Why would American doctors, with all the resources at their disposal, choose the Philippines of all places for such an important education? The answer will surprise you. And by the end of this story, you'll understand why more and more families are making the same decision. Let's start with the hook. In the United States, medical school is a mountain that very few can afford to climb. The costs are crushing. The competition is overwhelming. And the years of study can leave young doctors drowning in debt before they even treat their first patient. Imagine graduating with $200,000 or more in student loans. Imagine spending the next 20 years paying it off while trying to build a career and a family. This is the reality for many American students. But what if there was another way? What if you could get the same quality of education, the same training, the same hands-on experience, but at a fraction of the cost? That's where the Philippines comes in, and that's why American doctors are sending their children there. The Philippines has quietly built a reputation for medical education. Universities like the University of Santo Tomas, Cebu Doctors University, and the University of the Philippines are producing doctors not only for their own country, but for the world. Their programs are rigorous, their professors are highly qualified, and their training is practical because in the Philippines, medicine is not just theory, it's experience. Students are exposed to patients early. They learn bedside manner. They see diseases and cases that many American students only read about in textbooks, and this exposure shapes them into well-rounded doctors. American doctors understand something very important. Medicine is not just about knowledge, it's about compassion. It's about adaptability. It's about being able to treat people from every walk of life. And in the Philippines, that's exactly what students experience. They see patients from rural villages, from busy cities, from all economic classes. They learn to diagnose without always having the most expensive machines. They learn to rely on their minds, their skills, and their instincts. And those are lessons that create stronger doctors. And then there's the cost. This is a big one, because in the United States, the price tag of becoming a doctor is astronomical. In the Philippines, the cost is a fraction. Tuition fees are far lower, living expenses are affordable, and yet the quality of education is respected worldwide. American families realize they can save hundreds of thousands of dollars, and when their children graduate, they can take the same licensing exams, apply for residency in the U.S., and build careers just like their peers, only without the crushing weight of debt. For many families, this is not just a smart choice, it's the only choice. Another reason is language. The Philippines is one of the largest English-speaking countries in the world. Classes are taught in English, textbooks are in English, and communication with patients is also easy because most Filipinos understand and speak English. This removes one of the biggest barriers that students face when studying abroad. There's no language gap, no confusion, no delay in learning. Students can focus on the material and the training without struggling to translate. And this makes the Philippines an attractive destination for American families. But here's where it gets even more interesting. American doctors who studied in the United States see the value of cultural diversity. They know that in the future their children will be treating patients from all backgrounds. And what better way to prepare them than to study in a country like the Philippines, where cultures mix, where healthcare challenges are diverse, where students learn empathy not just from lectures but from real human interaction. This kind of training builds doctors who are not only technically skilled, but emotionally intelligent. And that's exactly what the world needs. The success stories are already here. Many American students who studied in the Philippines have returned to the United States, passed the U.S. medical licensing exams, and are now practicing as doctors, some in family medicine, some in surgery, some in specialized fields. Their parents, many of them doctors themselves, are proud because the decision they made to send their children to the Philippines paid off. Their kids are doctors, their debt is manageable, and their future is secure. And let's not forget the environment. The Philippines offers a unique lifestyle for students. The warmth of the people, the sense of community, the resilience of the culture. All of these shape the experience. Students don't just become doctors, they grow as human beings. They learn patience, they learn respect, they learn humility, and these are values that cannot be taught in textbooks. They are learned by living in a culture that embodies them every day. Think about it. When a young medical student spends years in the Philippines, they are not just studying. They are living among people who smile even in the face of hardship, who show kindness to strangers, who treat guests like family. These lessons sink in. They become part of who the student is, and when they return to the U.S. and treat patients, they carry that compassion with them, and patients feel it. American doctors also recognize the global reputation of Filipino healthcare workers. They've seen Filipino nurses, caregivers, and medical professionals excel in hospitals across America. They've witnessed their dedication, their skill, and their compassion. So it makes sense that they would trust the Philippines to train their own children because the results are visible right in front of them every day in American hospitals. Of course, some people ask, is the education really good enough? And the answer is yes. Philippine medical schools are recognized by international boards. Their graduates take and pass the same exams as any other foreign-trained doctors, and the proof is in the numbers. Year after year, Filipino-trained doctors enter the U.S. system and thrive. The education is not only good enough, in some ways it's better, because it emphasizes adaptability and resilience. And adaptability is a word that matters in medicine because no two patients are alike. No 2 days are the same. Doctors must think quickly, act wisely, and connect deeply. And these are exactly the qualities that studying in the Philippines develops. Qualities that many American doctors want their children to have. So why the Philippines and not another country? After all, there are other affordable medical schools abroad. But here's the truth. Very few combine affordability, quality, English instruction, cultural diversity, and global recognition the way the Philippines does. It's the complete package, and that's why it stands out. Imagine being an American parent, a doctor yourself, knowing how hard the road is, knowing the years of sacrifice, the sleepless nights, the debt that hangs over young doctors like a shadow. And then imagine discovering that your child can become a doctor in the Philippines with world-class training at a fraction of the cost, while also growing into a compassionate human being. Wouldn't you make that choice? That's why so many already have. The Philippines has become more than just a destination for tourists looking for beaches. It's become a destination for families looking for futures. And the fact that American doctors, people who know medicine inside and out, are sending their own children there, is the strongest proof of all. They wouldn't gamble with their children's future. They wouldn't risk years of study and sacrifice unless they were confident, unless they knew it was worth it. So the next time someone asks why American doctors are sending their children to study medicine in the Philippines, the answer is clear. Because the Philippines offers opportunity, quality, compassion, and affordability in a way that no other country does. Because it shapes not just doctors but people, and because it gives their children a future without the crushing weight of debt, a future filled with knowledge, skill, and heart. And in the end, that's what medicine should be about. Not just science, but humanity. And that's the story that more and more families are discovering, a story that is changing lives, shaping futures, and proving that sometimes the best opportunities are not found in the places you expect, but in the places you never thought to look. And the Philippines, with its rich culture, strong education system, and global reputation for care, is one of those places, a place where dreams of becoming a doctor are not only possible, but within reach.